Depending on the type of surgery you have, you may be required to spend the night in the hospital. If you do spend the night in the hospital, one of our physician assistants will come and visit you the morning after your surgery. We'll come in, we'll make sure that your surgical pain is controlled, that you're able to eat, you're able to drink, you're using the restroom, and that you're walking. We'll check all of your surgical sites, make sure that your surgical garments fit you correctly. Once we determine that you're ready to go home, we'll give you instructions on how to recover while you are at home. We'll discuss with you any medications that were prescribed, any exercises or restrictions that you have, how to care for your surgical sites, and how to notice an infection and when it's an important time to call your physician. Here at Florida Plastic Surgery Group, we work as a team. So even though you may not see your doctor in the hospital after your surgery, we can assure you that they do know every single detail of your care.
During your procedure, you may have a surgical drain placed at the surgical site. That will be responsible for collecting some of the fluid that will be accumulating into a small tube that will come out from the side of the body. We'll be able to talk you through all of this during your appointment, so you'll know if that's something that you'll be getting during your procedure. And then afterwards, following, we'll give you an education on how to take care of that drain. Just in summary, where the drain comes out from the body, we will teach you how to strip the drain to keep it clear of all blood clots or fluid clots. And we'll teach you how to record the amount each drain is putting out. And we'll give you a chart for that recording. It's very important that you bring that log with you to your post-op appointment, and at that point in time, we will assess the amount and determine whether those drains will be coming out at that appointment or if they need to stay a little bit longer to do their job.
Following your initial surgery with tissue expander placement, we will see you back at your first post-op visit 1 to 2 weeks after surgery, and then weekly thereafter. During the weekly visits, you will be met with one of the physician's assistants in order to have your tissue expander fills. Now, as an example, this is a tissue expander. Although the height and width may not be exactly like this, it will be tailored to your specific chest dimensions. This is what we will be placing during your initial surgery. Following that, at your weekly visit, you will come in for tissue expander fills using a very thin needle and this magnet in order to locate the port. Now on the port, the central area here, there is a piece of metal that we can detect using this magnet. This shows us the location that we will be looking for in order to use the needle that goes in order to fill. Initially in surgery, the tissue expander is going to be folded like this, 1, to expose the tabs, and 2, because just like with a baby, you can't put an 8-pound baby in a flat stomach. We'll be slowly growing it over time at each of these weekly visits. Eventually, to where the tissue expander will look something more like this and have a little bit more of the projection and shape of a natural breast. Now, each visit we will come in, we will clean the area with betadine and or alcohol, depending on your specific patient allergies, use the magnet to locate the metal, and then take a very thin needle inserted in this area in order to go in, hit the back of the metal, and then slowly fill the tissue expander. We fill generally about 2 ounces at each fill, or 60 cc's. After we have performed the fill for that day, we will be removing the needle, and this gelatinous area will seal back over, preventing any leaks, which allows us to continue to fill and add projection. Tissue expanders are often described by women as bricks on their chest. These are very functional, and your implants, when we do the exchange at your secondary surgery, will feel very different than the tissue expander itself.
ERAS will help you to recover faster after surgery. You will be given a cocktail of medications before surgery. This will stop the pain before it even starts. The second is, during surgery, we will use nerve blocks and inject numbing medication to stop the pathway of pain while you're asleep. The third part of this protocol is the use of a combination of medications that will target different aspects of pain while decreasing the need for narcotic pain medications. One of the physician assistants will talk you through these medications for after surgery. You will also be given a medication log that will walk you through step by step how to take these medications once you get home. Using ERAS protocol greatly decreases the side effects of narcotic pain medications, such as nausea, vomiting, and constipation. Of course, if this medication protocol is not enough to keep you comfortable after surgery, we will not hesitate to give you something more to ensure that you are more than comfortable as you recover.
I hope this video was educational for you. We wanted to provide as much education as we could before seeing you in person. On behalf of Dr. DeFazio, Dr. Parks, Dr. Faluco, and myself, Dr. Desai, We look forward to seeing you. Thank you on behalf of Florida Plastic Surgery Group.